know I said I was going to make a video about antifungals, and there's some great antifungals for the digestive system. For reals. Most of them are compounded, some of them are a little bit eclectic, so it's not your classic diflucan situation. However, I really got stimulated by this question that somebody asked me on one of the platforms. And so I want to talk about that first. And the question was, if sulfur is antimicrobial, how does it distinguish between what you actually want to get rid of and what you want to keep? Okay, let's dive into that. Here's my response. Good point. How do antibiotics, how do doctors get lured in by drug companies who tell them that Xifaxan, rifaximin, doesn't harm the beneficial species? We cannot make blanket statements about the human microbiome because we are still learning about the hundreds of beneficial species. Just because Lactobacillus and Bifidobacterium are the most numerous does not mean there are other less populous species that are not making a huge impact on the orchestration of the system. How do educated individuals take that information at face value based off a couple of limited funded drug studies when the long-term fate of their patient's immune system is in their hands? Why is this something that's being taught at naturopathic medical schools, at functional medical schools? Why are these people teaching the young doctors that taking antibiotics course after course after course to treat SIBO is a reasonable solution? And how do other antimicrobials distinguish between species in your digestive system, in your microbiome? The natural ones, allicin, oregano, berberine compounds, they don't distinguish between species. Whatever the mechanism of action is, it will impact the species that use that mechanism. It may be a protein target, it may be a toxicity, it may be an interaction between the targeted species and the chemical, which in turn is lethal. The point is, we don't know enough to say what is actually happening in our system with the interaction between these nutraceutical chemicals and our microbiome, because there's an exponential number of moving parts. However, I'm willing to entertain that there's a beneficial alternative impact with nutraceuticals versus drugs, based on the evolutionary relationship in their interaction with our bodies. They support us in so many pathways beyond the antimicrobial because of their complexity of action, whereas manufactured drugs have one single biologic target which produces its effects and side effects. So that's important, right? Like, if you are in an emergency situation and you need to get rid of a bacterial infection because it's life or death, or you have an accident and you have open wounds and you need to treat them, those are times where, antibiotics are beyond a gift to us for emergent medicine. For chronic symptoms where you have other choices, they might not be the best choice. So a single manufactured drug has one single biologic target that produces its effects and side effects. There was a morning a few weeks ago where I did a deep dive and found that in terms of Xifaxan's mechanism of action, the one that's recommended for SIBO and prescribed for SIBO, there are far more subspecies being lowered, if not eradicated, by this drug. And this is further impacted by the repeated use of this drug. I've treated people who have gone through this Xifaxan roller coaster up to five times before they got off and started to question, what am I doing here? Xifaxan,
SIBO test, Xifaxan SIBO test. And this person who's, I respect and is highly educated is telling me that this is what I need to do. But the symptoms keep coming back. So wait a minute. Is this really a good idea? There's a video somewhere in my archives on, probably the best place to go is my website, gijanelle.com, where I discuss the probiotic effect of sulfur and the antibiotic effect of sulfur, and it appears from the data that the conversation between the gut microbiome and sulfur is dose dependent. And I've added that information to my lectures where I teach doctors how to use this protocol for their patients. Because I want you to be well.